Who should be tested for obstructive sleep apnea? Well, if you have the symptoms that we said, if you're a snorer, if you're annoying your bed partner and they're kicking you out of bed because of the loud snoring, if you find yourself really tired during the day, or there's a questionnaire we typically ask. It's called a stop bang questionnaire, and that's asking people if they snore, if their bed partners have witnessed them to stop breathing when they're sleeping, if they have poorly controlled high blood pressure, if they are a man over 50 years old, if they have a really thick neck, or just general obesity or overweight are all risk factors. We look at all those and then we can determine how much a risk person is at for having obstructive sleep apnea. Another thing we do is we implement a subjective screening test to evaluate how tired people are. Like I said, you may be tired and you're not really realizing it. So what we ask is an 8-point question to ask people, how tired are you in certain situations? When you're sitting and reading, when you're watching TV, or just lying down to rest, what's the chances you'll actually fall asleep in those situations or feel like you really want to sleep? That's called an Epworth Sleepiness Scale, and if you score above a 10 points on that, it's a 3-point scale. If you score over 10, we get concerned that you actually do have poor sleep and are way too tired pathologically. And so then with all those factors, you actually should be tested. So how should you be tested for sleep apnea? No one really wants to go into a sleep facility, an institution, and have it tested. And there's newer ways that we're doing that. We're actually able to do testing at the convenience of the patient's own home. Most of our patients actually prefer that. However, there are some patients that still require to go into the sleep lab to be more thoroughly assessed. People who need those tests are people with a neurological condition where their muscles that help them breathe are affected. They need to be evaluated in the sleep lab. Or if you have significant heart issues, you should be monitored in the sleep lab. We also send patients for this in-lab sleep test if we start someone on treatment and they're just not responding, and we need to be more comprehensive or more detailed in what the best treatment are. So what's involved in a sleep test? So we said that you could actually go home with it, and it's really easy. What you'd do is you'd come to our office, you'd pick up a little package. In the package, it has a home sleep test monitoring device. The computer that records your breathing is attached to a belt. You snap the belt on your chest. The belt has a spring sensor on the side that's monitoring your chest movement, that we can see if there's respiratory effort, if your brain is telling you to actually breathe. So that's the first step. Then it sends that you put a cannula in your nose. That's the thing that when you're in the hospital you get oxygen with. You need to put tape on that to hold that into place. And then we slide a probe, a pulse oximetry, that measures your oxygen and your heart rate during sleep. What we see is quite simple. During sleep, your chest is moving, your brain's telling you to sleep, but because there's this blockage in the back of your throat, there's no airflow out your nose. And because there's no airflow, that can last at least 10 seconds for us to consider it a concern, up to 60 seconds or longer. And then clearly, if you're not breathing, you're suffocating, and then your oxygen levels really plummet. And by at least 4%, we have to see that to call it abnormal. So what we consider abnormal is if people are having more than 15 times per hour their airway shuts off and they can't breathe. That's concerning, and that's probably going to lead to serious health issues.